Hi everyone, welcome back. Our digestive health plays a significant role in our overall well-being. Digestion is what allows our body to break down the food that we consume, absorb essential nutrients, and eliminate waste. However, many people overlook one critical aspect of our digestive health. That is the health of our stool. Our stool can provide us with vital clues as to our digestive health and overall well-being. In today's video, we will discuss what a healthy stool looks like, signs that you may have an unhealthy stool, factors that affect your stool, and how to improve it. Hi, I'm Katie Bailey. I'm a gut health dietitian at Oswald Digestive Clinic, where we help individuals improve and resolve their bothersome gut issues like gas, bloating, diarrhea, constipation, and abdominal pain. If you or someone you know is experiencing these symptoms and would like to work with our clinic, you could click the link below in the description box to make an appointment. I've also linked our guide, 5 ways to improve your gut health, as well below if you'd like to get started right away. Okay, let's start on today's topic. Healthy stool is a sign of a healthy digestive system and can indicate a healthy diet and proper hydration. Your stool can help you identify any potential issues in your digestive system, like lack of fiber, dehydration, or the presence of infection or disease. It can also be an indicator of how well your body is absorbing the nutrients from your food. So what does a healthy stool look like? The best way to describe what a healthy stool looks like is to use the Bristol stool chart, which is a medical tool that's used to classify stool. This chart describes 7 types of stool. Type 1 is separate, hard lumps like nuts that are hard to pass. Type 2 is sausage-shaped but lumpy. Type 3 is like a sausage but with cracks on the surface. Type 4 is like a sausage or snake but smooth and soft. Type 5 is soft blobs with clear-cut edges. Type 6, fluffy pieces with ragged edges, and it's a mushy stool. And type 7 is watery, no solid pieces, entirely liquid. A healthy stool would be considered type 3 or 4, which suggests that you are getting enough fiber and fluids in your diet. Another thing to remember is that stools should be brown, and this color comes from bilirubin, which is produced by the liver when you break down red blood cells. Now, there are several factors that affect the health of your stool. Things like your diet, your hydration, your physical activity level, stress, medications, and any underlying conditions you may have. Diet helps to determine the consistency, size, and frequency of your stool. Consuming a diet rich in fiber helps to create bulk in your stool and makes it easier to pass, while a lack of fiber creates those hard, lumpy stools that are difficult to pass. Dehydration causes your body to pull water from your stool to make up for the lack of fluids in your body. So that leads to those hard, lumpy stools that are also hard to pass. Now, unhealthy stool can manifest in several different ways. Now, if the consistency is not that normal type 3 or type 4 that we talked about in the Bristol stool chart, that could indicate that your stool is on the unhealthy side. So those hard, lumpy stools that are hard to pass could indicate constipation, and the loose, watery stools can indicate diarrhea. Another thing is the color of your stool could deviate from the standard brown. You could see things like red, black, green, yellow, or white stools. Your stool could be foul smelling, or you may see things like fat, mucus, or blood in your stool as well. And all those things would be a sign that your stool is on the unhealthy side. Improving your stool generally involves making changes to your diet and lifestyle. First, you want to ensure you're getting adequate fiber. Like I mentioned before, fiber adds bulk to your stool and helps it move through the GI tract easier. Fruits, vegetables, whole grains, beans, nuts, and seeds are all great sources of fiber to include in your diet. Secondly, you want to stay hydrated. It's very critical because this helps to soften the stool and make it easier to pass. Third, you want to engage in regular physical activity because physical activity helps to stimulate the muscles in your intestines and help promote healthy bowel movements. Lastly, if you are concerned about the color of your stool, we did a previous video recently on the potential causes of different stool colors, and that video you might find very helpful if you're concerned about your stool color. And if you are concerned, then reach out to your healthcare provider just to make sure that there's nothing going on that may need to be addressed. So in conclusion, while it's normal for your stool to slightly vary from day to day, significant changes in your stool that persist for more than a few days can indicate an underlying issue, and it's a good idea to seek medical advice. Maintaining your digestive health, which includes the health of your stool, is essential for your overall health. By understanding what a healthy stool looks like and what factors affect stool health, you can take proactive steps to help improve your digestive health. If you liked this video, please hit the like button and subscribe for more nutrition videos. If you're interested in working with our clinic, you can click the link below in the description box to schedule an appointment. Thanks for watching.